The most accessible tool to help detect breast cancer is right at your fingertips. Self-breast exams can help you detect breast cancer early by looking and feeling for anything out of the ordinary, like lumps, bumps, or dimples you haven't seen before.
I've always told patients that they tend to know their own body better, so if it's something that they've done for some time and have a good understanding and knowledge of their own body, that looking for anything that they haven't felt before that feels new or different is worth at least bringing up.
There's no right or wrong way to go about it.
But we usually will say start with one breast, use both hands to kind of palpate the tissue all around the breast.
But the self-check shouldn't stop at the chest.
Some breast tissue can go up towards the armpit, so including that in the evaluation and trying to do that same method on both sides each time they do that exam.
Taking a moment to do an exam can help you stay in tune with your body and increases your chance of noticing a change that needs further evaluation.
People, when they come to office, will tell me they'll do it once or twice a week, whether they're showering or doing their own self-care. So 2 to 3 times a month may be reasonable just to keep up with it, and then they get more accustomed to knowing what's normal or abnormal.
If you do notice something of concern, Dr. Thorpe says you shouldn't hesitate to reach out to your provider.
If they have any question at all, the first thing I tell them is to come in for an exam. We'll perform an exam to see if we feel anything that they also felt. And then the next steps usually include some sort of imaging, whether it's mammogram or ultrasound. Those differences will vary by each individual patient.
While it is recommended that all women at the age of menstruation and beyond perform self-exams, Dr. Thorpe advises those age 40 and older or at higher risk of developing breast cancer to check themselves regularly. For Arnett Health, I'm Lexi Cutmore.